Today we're reporting with you about the events that occurred in 2015 on Sunbury Road. These events wanted to be concealed by the government due to the mass panic and the situation that our world was going through at the time. However, today we have the inside scoop with one of the university students who encountered that tragic day. Alex, do you mind talking about it?
I was really good friends with him. His name was Matt Hall. And I remember the day that he came back from his mission trip, he started getting sick. We all just thought he had the flu.
So now today with me, I have someone who worked very closely with Matt, especially towards the end of his life, and probably knows him the best out of anyone in this room, Dr. Jamil. And today she's going to be explaining to us what happened on that tragic day with Matthew.
So Matt came in, and initially I believed that it was the flu because of his symptoms. There was just fever, headache, stomach ache, common things of the flu. So I gave him some antibiotics and hoped for the best that that would help.
So Alex, tell me about the quarantine and what went down during that.
This was when we first heard that Matt had Ebola, and we were all so surprised. A little bit after that, we all had to gather for a group meeting in the gym, and they had to explain to us Matt's condition and that any of us could be contaminated by him. We all had to get tested, and until the results had came back, we weren't allowed to leave campus. And the government and all the police officers made sure that we wouldn't leave campus.
Why do you think these symptoms occurred the way that they did?
I was not quite sure because Ebola is very complex, so that was not my initial thought. It's very hard to determine Ebola with the symptoms. The symptoms, early stages, are mostly flu-like, so I did not think that it was going to be Ebola.
With a virus that is this complex, as you put it, how do you go about treating that, or what do you go about to try to get rid of it or resolve it?
I did initially the early treatments that I started to do were giving him electrolytes to help his oxidation states and keep that high. But then it got down to blood transfusions, which were meant to help with his infected blood. So after a couple of weeks of giving him blood transfusion, it just died off and didn't really help.
Why did you go about these treatments? Why would these help him?
The treatments help him, would have helped him, should have helped him, because blood transfusion and getting electrolytes back in your system, that's something that when you do have a virus as complex as Ebola, it does help it, or most commonly should help it. But in Matt's serious case, he was too far along.
It's events like this that happen in our world that make you really appreciate life at its fullest. So let's hope that in the end, that this day never happens to us again.